Lisa, your physical exam's normal. Seems like you've been doing a very good job of taking good care of yourself and your health. And I'll send you your lab results when those are back, and plan to see you in about a year.
Okay.
I noticed you filled out one of our alcohol questionnaires. Could I look at that and give you a little feedback?
Yes.
And let me just verify a couple of things. On average, how many days a week do you have an alcoholic drink?
2 to 3 days a week.
Okay, and on a typical drinking day, how many drinks would you have?
1 or 2 drinks.
1 to 2 drinks. And what's an average drink for you? What do you normally drink?
Margaritas.
Okay. And you ever have time when you go to 3 or 4, or a little bit more than that when you're special occasions?
I do.
Okay.
When I'm out with my husband, we usually have more than 2 or 3. So, yeah.
Okay. And in the past 3 months, have you used marijuana, cocaine, heroin?
No.
Okay. Any sedatives or pain medicines in a way that was not prescribed?
No.
Okay. Well, you scored 9 on our questionnaire. Would you like to know what your score means?
Yeah.
Okay. Well, out of a total of possible 40 points, you scored 9. This thermometer here shows you sort of the range of scores, and your 9 puts you right in the middle here in a category called at-risk drinking. What are your thoughts about that?
At-risk drinking. That's concerning.
That's concerning?
Yes.
Can I explain that a little bit to you?
Please do.
Great. Well, the National Institute on Alcohol Abuse and Alcoholism, because we recognize that alcohol can be harmful to our health, has determined what they call limits of lower risk drinking. So these are things that will keep you out of problems related to alcohol. And for healthy women like yourself, the recommended limit is no more than 3 drinks on any day that you're drinking, and no more than 7 drinks, total drinks in a week. The reason for that being that if you exceed those 3 drinks a day, then you're more at risk to have accidents, falls, get into arguments with other people. And if you exceed the 7 per week, then you can damage some of the organs like your body. You start to get liver damage, stomach problems, even increase your risk of cancer. For example, 7 drinks a week increases a woman's risk of breast cancer.
Wow.
Is that new information?
Oh, yeah, it is.
Yeah.
It is. Yeah.
What are your thoughts about that?
Well, I just didn't know that, drinking alcohol could have those kind of effects.
Yeah.
And I know I've had more than that on occasion. You know.
Well, tell me a little bit more about your drinking. What are some of the positive things and good things for you about drinking?
For me, drinking, I like to drink with my husband. Usually that's who I drink with when we're out, having a good time. And through the week, I have a couple of drinks through the week, and so generally that's about it. But, it's usually just like occasional type of things when we go out. And we paint the town, as you will.
So it sounds like it's fun for you, and it's enjoyable because you have that special kind of bonding with your husband about that.
Yeah.
Any not so good things about your drinking?
Yeah, come to think of it, sometimes when I drink, I notice a pain in my stomach, and I'm not sure where that's coming from. And I also notice sometimes I feel out of control, and I don't like that feeling.
Yeah. So some of the not so good things are that out of control feeling when you've had maybe a drink or two too many and some pain in your stomach.
Yeah.
Which, as your doctor, I can tell you, is probably the irritating effect of alcohol on the lining of your stomach. Well, on the one hand, then, it is fun for you, and you enjoy that time with your husband. On the other hand, it makes you feel uncomfortable sometimes and causes some pain in your stomach. And now you got some new health concerns. Where does that leave you in terms of staying the same with what you're doing or making some kind of a change?
Well, I would like to make a change. I think it's important with the information you've just given me. Yeah.
On a scale of 0 to 10, with 0 being not very important and 10 being very important, how important would it be to you to make a change?
I'd say a 6.
6, that's a pretty high number. Why a 6 and not a 5 or a 4?
Probably because I'm having some pain in my stomach, and you say that may be related to my drinking.
Yeah.
and that's concerning to me.
So you're really concerned about the physical effects for you.
Yes.
Let me ask you another question. If you decide today, yeah, I think I want to make a change, how confident are you that you could just make the change and be successful at it on a scale of 0 to 10? How confident are you?
Well, I would say a 10 on confidence. Because when I put my mind to do something, I always just can commit to it. So, yeah.
So you're pretty confident that you make a decision, you follow through on it, and that's it.
That's it.
Good. Well, tell me any thoughts you have then about, say, a specific plan, how many days of a week, or how many drinks you'll have when you go out.
Well, I'll probably still drink like 3 days a week, but I think I'll cut back on how much I'm taking in. So probably 1 drink a day, or 1 to 2 maybe one day out of the week, but I'm going to keep it low.
Oh, great.
Yeah.
And that certainly is under these limits that we talked about. I think that's a great plan, Lisa, and I think that's something you could very easily accomplish. Sounds like you're very clear in your thinking, and it's in accordance with your values. Would you like some more information about these drinking limits?
Oh, yeah, sure.
Okay. We have a brochure that talks about health effects of alcohol and those healthy drinking limits, so you can take that and get a little bit more information. And I think you're going to do great. You, again, just taking good care of your health. You care about your body. And if I can be of any help, give me a call back. Otherwise, I'll see you in a year.
Okay.
All right. Thanks so much.
Thank you. All right.
Bye-bye.